heart is racing. You're dizzy every time you stand up. You feel like you're vibrating from the inside out. You've seen the cardiologist, the neurologist, the primary care doctor. They tell you your heart is fine, your blood work is normal, and it's likely just anxiety. Here's an SSRI. They're looking at the pump, but they're ignoring the computer. If you have POTS, the problem often isn't your heart. It's the communication line between your brain and your body. That line runs directly through your upper neck. You see, here's the problem when it comes to the autonomic disconnection. POTS is considered a form of dysautonomia. This simply means that there's a malfunction in your autonomic or your automatic nervous system. This system controls everything you don't think about. Heart rate, blood pressure, hormones, digestion, you get the idea. At the very top of your neck, sitting right under your skull, right here, is the atlas bone. It surrounds your brainstem. This is the grand central station for your nervous system. When this bone misaligns, even by a millimeter, it will create mechanical tension and neurological noise. It irritates the vagus nerve, which is responsible for telling your heart to change, to slow down. When that signal is jammed, your body loses its ability to regulate itself. So you may ask yourself, why the neck? Why does the neck matter? I don't have neck pain. I have no injuries. Why would I get my neck checked out for a heart issue? Two reasons. Number one, the vagus nerve. It exits the skull right next to the atlas bone. If that bone is displaced, it can physically interfere with the vagal function, leaving your fight or flight system stuck in the on position. Number two, blood flow. Your vertebral arteries pass through these upper cervical bones. When they misalign, they can affect the blood flow into the cerebellum and the brainstem, the areas that control your upright posture and your balance. When you stand up, your brain doesn't get the signal to constrict your blood vessels correctly, and the result, your heart overcompensates by racing. That should make sense now. So what's the solution? Precision, not guesswork. Most people try to manage POTS with salt, compression socks, medication, sometimes SSRIs, right? Anxiety drugs. But those are Band-Aids. You and I both know they do not fix the underlying neurological interference. In my office in Southlake, Texas, we use objective 3D x-rays and infrared paraspinal thermograms to see exactly how your atlas is positioned and when there's an interference present. We do not crack or pop the neck. We use calculated precise adjustments to restore the atlas to its proper biomechanical position, taking the pressure off the brainstem and allowing the vagal nerve and autonomic system to come back online. If you're tired of being told it's in your head, it's time to look at the base of your head. Stop negotiating with a broken nervous system. Click the link in the description and schedule a consultation at Hope Upper Cervical in Southlake. Let's find out if your upper cervical spine is the reason you aren't getting better. Subscribe below for week 2, where we'll dive into the specific neurology of atlas misalignment.